My name is Erna Vennes. I'm an acupuncturist. I come from Germany, where I worked as an MD in anesthesiology. When I was a regular doctor, I was working in this big machinery of a university hospital with many people, many buildings, and many spaceship operation rooms. And now I'm here in my little private practice, working on my own in one little room with one patient at a time, and far away from the big hubbub of a university. And I like it both. I was working at a university hospital who had exchange doctors from China, and they were very interested in our newest machinery, and we always stuck them into the outpatient pain clinic because they had real good results with doing acupuncture for pain management for outpatients. And so I got interested, and then I saw a little video clip of an operation that was done with acupuncture anesthesia only. Where the patient was awake, and it was a thyroid operation. And so with a thyroid operation, you always have this danger that you cut a nerve that innervates the vocal cords. And so they talked with that patient to make sure that they are away from the nerve. That was very impressive, and so I got very interested because especially for patients for whom the anesthesia is more dangerous than the surgery. We always looked for alternatives, and so that was when I started taking classes in acupuncture. I got drawn into it because of my life path. When I got interested in acupuncture, I saw it only as an adjunct to conventional medicine. And since I did a little stint in research, I was very much in love, and I'm still very much in love with science. So, but when I came to this country, the question was whether I take care of my kid, who was 2 years old by that time, and go back to hospital work, or to stay at home and see her grow up. And I chose the second one, and because you couldn't keep me away from it, I started getting interested in acupuncture schools, and it took me a few classes until I met a very inspired teacher and inspiring teacher, who made it clear to me that herbs are working just in a very different way than medication.
My name is Ian Chase, and I'm Anna's patient. Pretty much when I was younger, I had a weird condition where every almost exactly 110 days, I'd get kind of this weird, they think it's a migraine dizziness basically. And I would be sick for an entire week and wouldn't be able to go to school. So we were kind of desperate, so we found Anna. Well, we tried regular doctors, but they just gave us something called like Diamox, and that stuff was god-awful. And it pretty much everything hurt. Like it leached the potassium out of you, so it would your muscles would get really sore.
My name is Corinna Mori, and I am a patient of Anna. And I thought I'd injured my shoulder 4 years ago. It actually turns out now it's my neck that I injured 4 years ago, and I went through shoulder surgery, and I've had hundreds of bouts with physical therapy, and nothing helped me. So anyway, at that time I'd given up on conventional medicine, and I decided to go and see Anna to see if she could help me.
I mean, the first appointment, she didn't actually treat me. She just showed me what she was going to do, and then ever since then she's been stabbing me with needles for about 10 years now.
In Chinese medicine, we sometimes have to change little things, many of them, and then we bring people back into balance again. So it's juggling with a little bit more small things and not just hitting it with one big thing. Usually my patients are not that easily to be influenced by words or by energy. So it is more, it requires a closer look. And since I do not have lab work or MRIs, I need to use my body as a diagnostic tool. And so, and I think I developed that quite meticulously, that I listen how the voice is. I always go near enough to a patient to smell whether the smell was all of a sudden changed, how the skin tone is, how their posture is when they sit down. I try to go in my room behind my patients so that I can see how they're walking, how they're moving. And so the relationship to my patients is much more detailed, because I don't have so many image giving or signal giving devices. You know, when I was an anesthesiologist, I had a very close connection to my patient via putting a stethoscope onto his chest, or looking at the oximetry or something like that, or I had all these alarms or beepings that used my senses so that I knew what was going on with the patient. And now I don't have any mediators anymore. So because this is holistic medicine, I also always insist on talking with my patients and finding out what's going on in their life, because that has a real big influence on the energy. And sometimes people don't tell me, and then I have to read it from their pulses, or get other ways of getting my diagnosis going.
She looked at me after an hour and she said, "You know what, your shoulder is secondary to what's underlying, and you have huge anxiety issues, and I think it can really help you with acupuncture and also with talk therapy." Basically, Anna really acts as a coach more than a real therapist. So the way the sessions work with her is that a 60-minute session is divided up into a 40-minute chat where we talk very specifically about things going on in my life, and she will and then after those 40 minutes I'll end up on the table for 20 minutes, and then we do the acupuncture.
First, before I start the treatment, I have to do my diagnosis, and I do my diagnosis by feeling your pulses on both sides and looking at your tongue. I'm working with sterile needles that are packed in a guide tube. So, that's a hard packaging outside. First we have to clean it with alcohol, and then we put the guide tube on, insert it, remove the guide tube, and insert the needle a little bit deeper and manipulate it.
They're not that bad. She describes them as cat whiskers. They're a little bit stronger than that, but that's a pretty good description. It does sometimes, like if it's a really, the energy points, if she gets one that's hurting. Like one time I had a really bad cold, and she got one that helps with the lymph nodes, and that actually hurt. And I said, and she had to take out the needle because it was pretty intense.
My style is to be gentle with the body, be gentle with the needle stimulation. And usually my patients cannot even say what I did with the needles. So, but as long as I get the results, I don't need the body tricks.
I'm not sure whether the acupuncture in and of itself is really helping me. It very well may be. I'm not 100% sure. I know though that her very hands-on approach with giving me advice, she has very practical suggestions on how I can do things differently, or how I can organize my life in a way that I feel I'm in control of my life. And I think I've gotten much stronger from that. So I think that helps me for sure. She also prescribes some herbs that I take. I'm not sure they really work either, but I know for sure that that one part really does work. And she insists on the whole package. She thinks that I need all of those together. So when I'm on that table and she inserts the needles, I and she covers me up and then she leaves the room. So I have like 20 minutes there to myself and I'm just like floating on a cloud. I would say I think she's extremely intelligent, intellectually and emotionally. I think she can see through people very, very quickly. She's a good judge of character, and she can very quickly put a finger on where the problem lies. So I think she has a real talent there. She's very compassionate. I think she really dedicates her life to her practice and to her patients.
Yeah, Anna's a really incredible person. She's one of the nicest people I know. And so I'm half German, and I speak German with her. She's one of the few people I actually speak German with, so I get some practice in. And I can't say enough good things about her. She's just a really good friend and has been for years. Her activities, she sails a lot. She has her daughter and I think her husband as well. They all go out sailing, and she's pretty, not intense about it, but she's an active sailor, definitely. And she has her cat, and she does horse acupuncture, which she's talked to me a little bit about. And she is just a really good person, likes helping people.
With all the powerful medication that you have, you cannot do everything. So I would like to close my personal life circle with going back to intensive care, the most mechanized and scientifically rooted part of anesthesia, and see how I could help with the needles, how the needles would go, make a program where you have a visiting acupuncturist as you have a visiting physical therapist.